Some vaccine providers tell us they're ready and willing to administer a booster shot. It just has to be approved by the federal government. That could happen, we have word, by the end of this month. Right now, Fox 59's Kristen Askow is talking with some local doctors about this very rollout. Kristen, what are you hearing?
Well, Fanchon, doctors with Indiana University Health tell me they are prepared to administer booster doses of the Pfizer vaccine if that's approved by the FDA. Now, right now, third doses of the Pfizer and Moderna vaccines are only open to people with compromised immune systems. Officials with IU Health say a lot of patients in that group have shown interest.
So we're really pretty much ready. Once we know that we're going to have to do this, we can tool it up fairly quickly.
Dr. Paul Calkins says IU Health will have enough Pfizer vaccine if third doses are approved for the general population later this month. His team is already giving third doses of both the Pfizer and Moderna vaccines to immunocompromised patients.
I can tell you that many of our immunocompromised patients have gone for that third dose. Lots and lots of very strong interest in it.
Dr. Calkins says IU Health isn't planning any mass vaccination clinics this time around, since there are now more places offering the vaccine compared to earlier this year.
Frankly, we just don't have the manpower to open things for long hours each day and run thousands of people through them. Luckily, we've got lots more availability of vaccines in multiple other venues.
Federal health officials say they expect booster shots will likely be administered 8 months after your second dose. Dr. Calkins urges people to follow the FDA's guidance once it's released.
I would think that if the FDA recommends that you get the booster shot, that you should get it. And I certainly will. If I get the news from the FDA that I should get a booster shot.
Now, experts say you should stick with the same vaccine brand if you've already been vaccinated, and right now it's not clear when booster doses of the other vaccines, Moderna or Johnson & Johnson, could become available. Now, the Indiana Department of Health says it is waiting for more guidance from the federal government, but has started preparing for this potential rollout. Live in the newsroom, Kristen Askow, Fox 59 News.
All right, we know you'll keep us up to date, Kristen. Thank you so much. Meanwhile, world health leaders are asking countries to hold off on booster shots for a while.
Yeah, the World Health Organization says those vaccine doses should instead go to countries that have barely started their vaccination efforts. The WHO Director General says most high-income countries like the United States have vaccinated close to half their population, but lower-income countries are falling far behind. He says developed nations and pharmaceutical companies need to share.
Low-income countries have been deprived of the tools to protect their people. We don't want any more promises. We just want the vaccines.
The United States and other countries have promised to share vaccine doses with developing nations through what's known as the COVAX program, but that program is not living up to expectations. Just today, it reduced the number of doses it expects to deliver by 25%.